So joining us today, we have on Zoom here, we have Stephanie Foo. As I mentioned last night at the Mattingly Award, Stephanie was last year's winner for a piece that she led and worked on with the NPR Invisibilia team called Therapy Ghostbusters, which was excellent. I would recommend you all listen to it. But she is probably best known as the author of the best-selling memoir, What My Bones Know About Complex PTSD. She's also a previous. We also have Rhitu, specializing in mental health, especially the mental health of the most vulnerable populations. So pregnant women, children, minoritized communities, refugees. So these are the people that she is focusing the most on in her reporting. And we also have Judith Warner, another Carter Fellow, a former Carter Fellow, and author of "And Then They Stopped Talking to Me: Making Sense of Middle School," and a number of other books having to do especially with parenting and families and mental health. She's a freelance author and journalist, as well as an adjunct lecturer at Georgetown University. And she has worked on, as who mentioned it before? Kristen, I think it was you, the Carter guide on language and that sort of thing. So she's going to get into that later. But I think first we're going to start with Stephanie. Stephanie is going to, well, basically, this is going to be a fairly informal session, but it is one where we wanted to give all of them who have a ton of experience covering these issues and doing kind of trauma-informed reporting, talk about how they make sure that they are doing it right. And so I'm going to let Stephanie kick us off with how she approaches it, and then we'll go on down the line. So please join me in welcoming this panel.
Hi, everyone. Thanks so much for having me today. Really lucky to be here. So when I was first diagnosed with complex PTSD, I had never heard of it before, so I immediately Googled it, and there were only a few results. There was literally one result for I healed from complex PTSD, and most of the results that did exist were very pathologizing. There was a list of symptoms that was like changes in emotional regulation, chronic suicidal tendencies, explosive anger, a sense of hopelessness and despair. And I remember when I read that, I really did feel a sense of hopelessness and despair, obviously, because it seemed like everything that I could find was saying that I was broken. And there wasn't anything that was providing a first-person storytelling, and there was nothing providing real hope. And so, of course, I felt totally freakish. I felt totally hopeless. And I told myself at that point that if I was able to heal from complex PTSD, that I would write a narrative, write the narrative that I hoped that I could see at that moment, that would make me feel less alone, less like a freak, and with real solutions for moving forward. And I always talk about this quote from Chimamanda Adichie, that power is the ability not just to tell the story of another person, but to make it the definitive story of that person. And so I think with mental health reporting, if somebody doesn't know any people with schizophrenia or people with complex PTSD, your article, your story might be painting a picture, the only picture that some people might be able to see of this individual. And I think one thing that people tend to neglect is the fact that we ourselves, the people with schizophrenia, with PTSD, I think journalists and clinicians and people who write about mental illness, I think they don't often think about people who actually live with these conditions and how it feels for us to be represented in the media, to read about ourselves and read stories that are pitying, that are pathologizing, that are grotesque, um, that try to show the most hideous sides, I think, of some of these conditions in order to, I think, journalists are trying to show, oh, look, this is a real problem in America. Look at the horrible, like the life expectancy of complex PTSD survivors and how we're likely to die 20 years sooner. And I mean, okay, great. I guess what you're trying to do is, you know, showcase the impact of child abuse, but you're also making me feel pretty bad when you're saying things like that. And so when I am writing about mental health and when I'm reading other articles about mental health, when some things that I'm really trying to look out for are nuance, um, joy, trying to include the voices of people who do possess these mental health conditions and have them speak about the experience from their first person perspective, to make them not victims or uh, pathologize them, but again, make them nuanced individuals who feel joy as well as all of the other things that they feel. And to provide hope, to provide real solutions, to interview not just people who are really, really struggling with these conditions, but people who are actually actively healing and on the up and up, and what has been able to help them. So yeah.
Thank you. Um, uh, we will go to Ritu now, if you don't mind. And okay, great.
So what I thought, on a day-to-day basis, I'm covering, I'm covering a lot of reports, a lot of studies on like a whole range of things regarding mental health. I'm fortunate to get to focus only on mental health. But what I thought I would do is actually just talk about a specific story that I covered, which also happens to be related to workplace mental health, which would kind of help me talk about all the different layers that go into reporting the story, and mention like doing trauma-informed reporting, but also deciding and also understanding the various layers of the science, and being accurate and nuanced about the science, but also tell a very human story with nuance. But also decide how to tell the story. So the idea came to me through a psychiatrist who I'd interviewed many times before for stories around burnout, about healthcare worker, mental health, and a whole range of topics. And so this was sort of several years into me covering this beat and understanding and having had some experience covering suicide, understanding about sort of some of the bad ways you can report on suicide, and the sort of the real world harm that can happen from not practicing the so-called safe suicide reporting guidelines that are put forward by organizations like the American Foundation for Suicide Prevention. The fact that if you focus too deep into one story, if you oversimplify suicide, if you focus too much on one person, sort of or how they died, or or say, for example, too much into their misery leading up, sort of step by step, what led to the act, we risk causing harm to other people who may be struggling with suicidal thoughts, right? So that's a big consideration in pretty much all suicide stories that I do. But so the idea came to me through a psychiatrist who pinged me on social media and said, hey, I don't know if you've been following this nurse at Stanford, a critical care nurse, went missing, abandoned his shift, mid-shift, and has gone missing. And there's a huge effort organized by his friends and colleagues to go find him, but it's bringing up a lot of issues around healthcare worker mental health. So this is 2022. So, we're talking coming out of the pandemic when we're starting to talk about healthcare worker mental health and the toll of the pandemic, how their work was like, work conditions before, the burnout they faced before, and what the pandemic did to them. And then not very long after she reached out to me, she then again reached out to me again and said, this young man has died, 27 years old. They don't know for sure yet, but they think it's suicide. And his closest friends are willing to talk. Is this something you're interested in? And I was like, sure, I'll talk to them. But then, so I reached out to the person, one of his roommate and one of also a critical care nurse. He had a very close cohort of critical care nurse friends. And then I reached out to them, and for the longest time, there was no response. And I reached out to my source again, and she said, well, they've had a few really bad experiences of people covering just that event by local press, not by health reporters, not, by mental health reporters at all. And they ended up focusing on how awful it was, that how could he have abandoned his patients mid-shift? And so there was a lot of blame. And so, and clearly these are close friends that have seen this guy go through a lot, even up until his suicide, or what they thought at the time, and became clear over time that it was suicide. So they're hurting, they're traumatized. But anyway, we had an initial phone call. It was very clear this man wanted to get the story out, was hoping I'd be a responsible reporter to talk to, but was clearly he was still deep in grief and trauma, like in the thick of it. So the first conversation I had was just, basically whatever. And this is all happening over Zoom, which I have come to realize not the best way. In-person interviews on these topics are always much better. But eventually he did open up. He was willing to tell the story. He connected me to two of his other friends. And the thing that the more I talked to this little group, what became clear was the story was just not about this young man, Michael Odell, who died, and he'd been a critical care nurse traveling from place to place throughout the pandemic. So it's witnessed a lot, was carrying a lot. And also it became clear that his death had somehow broken this wall of silence around nurse mental health, that there was a tremendous amount of stigma. I think the country had started to talk about physician mental health, but not so much. Nurses had been kind of left out of the conversation. And when I was reporting it, the story really became about just, obviously telling kind of how, and the story was told, and I had to decide, Stat did the same story, and they decided to focus on very specifically on sort of Michael's own narrative and like talking to his family members, I think his brother. And I decided against doing that primarily because I decided to err on the caution of not going too deep into kind of step by step what led to him versus what were some of the layers of factors, again keeping in mind that suicide is never one cause. And it turned out that it dug more into Michael's story. These are his three friends, closest friends, from like their nursing school days. And this is Joshua Paredes, his roommate that I'd gotten in touch with. And so my reporting also had to reveal these sort of layers of fact that Michael had. He'd he'd witnessed a lot through the pandemic. He'd had a prior suicide effort attempt like a couple of years ago, but had sought help. This is Michael. Things to, he got to surround himself with friends, be close to his friends, but then went through the year before he died, went through a breakup, and his mom died suddenly, very young, when she was 50. So all these sort of hits, so in telling his story, it was more also sort of taking care to also lay out these layers of risk factors that often contribute to. So it became a story about, again, how, what Stephanie was just saying about these stories on mental health. We can't just do stories about sort of how sad somebody is or how terrible it is, because while these guys are traumatized from their friend's death, in grief, they've also come together to make an effort so that they would take their grief and trauma and make sure no other nurse left mid-shift and thought of suicide. So the death had also become sort of a wake-up call for nurses across the country, not just as friends, to mobilize, gather together, and try. And they were starting a nonprofit and starting a helpline, so that a place where nurses could call and seek help, a safe place for them to talk. So they were called Don't Clock Out. So they didn't make a sudden hasty decision that Michael did. But in the process, it also became a story about where hospitals and health systems are failing, right? They're working, at the end of the day, the conditions that healthcare workers were working with just got exacerbated in the pandemic. They weren't new. Yes, the COVID-19 added layers that were new, but the workplace factors that were contributing, workload, not enough staff members, like poorly staffed hospitals, lack of mental health care access. One of the big factors that I think contributed to Michael's death was the fact that he had, after his mom died, his friend said, don't be alone at such a vulnerable time, move back to the Bay Area. Josh said, move back with me. He also had a supportive set of friends. He wasn't like a loner just in misery. He was taking care of people. He had friends. He was trying to seek care, but there was a gap in his insurance, and he just couldn't find a therapist to see. And he had 3 months of medication, but he was waiting for his insurance to kick in a month after starting employment. And these are all the ways in which the system failed. So ultimately, it became sort of a multi-layered story, kind of telling how this nurse's death was really, it was a factor that so many healthcare workers and nurses are facing around the country, factors, and also just how they were finally coming together to mobilize, to push this, not just take care of each other, but push hospital systems and healthcare systems to change, to better address the factors that was causing burnout and mental health care issues in the first place.
Well, I'm going to be speaking a little more in general, probably, about some of the things that Rhitu just demonstrated so beautifully and concretely with her story. My name is Judith Warner. I've been interested in mental health forever, basically, and have been covering it, following very closely, really since about 2004, when I started work on my book, We've Got Issues, Children and Parents in the Age of Medication, which came out in 2010. And I'll just say something about it because it's relevant to all that we're talking about. A lot of it was on media. Basically, I started out writing a book about how children are being overdiagnosed and overmedicated and pathologized by pushy, competitive parents and complicit doctors, based on all of my beliefs about our obnoxious culture of parenting, especially in communities like Northwest Washington, D.C. And it was very easy to make that argument because that's what was being reported everywhere. It was really the line that was very strong in the media since the late 90s, was continuing, grew even stronger actually over the course of the 2000s. But when I started reporting the book, started actually interviewing people and started reading statistics and kind of learning in better depth about my subject, going beyond the, deconstructionist cultural critique from college that I had carried forward with me, I realized that I was wrong. And I did a complete about face on the topic and wrote a book about stigma, and about how we perpetuate forms of stigma that have to do with cultural narratives that the media repeat over and over again. So that kind of work, basically, I've taken forward over the years and have done in various forms, including the class at Georgetown. And along the way, after the book came out, I did the fellowship that was mentioned at the Rosalind Carter. I do, for anyone who's not familiar, fantastic. It was a fantastic, approached me last year about updating a journalism guide that they had published in 2015. And just it really, really needed to be updated. It was a big project we all did together. And the good news in doing that was seeing how much things had changed, a lot. Looking at, for example, the language guide from 2015, it was so rudimentary. It was things like, don't use words like crazy and psycho, and it was, at that point, even though at that point I'd been covering mental health for, a good over 10 years, learning about person first language was new to me, actually. All of this kind of seeped into the culture, and the really critical conversations about language that we've had since just weren't so much in the mainstream. So it was nice to see that people have changed so much in their thoughtfulness. And I do recommend the guide. I mean, not because I took the lead in writing it, but because I think there's a lot in there. There are a lot of resources, and there's a lot of research. I'll go to the next slide, please. So when I was, thinking about the theme of getting it right for today, that's really what we were trying to help people do. And we organized it around 3 essential questions, because the 2015 guide had sort of a similar structure, but we changed them. We tried to sort of boil it down to these questions. Is your reporting accurate? Do you have high quality sources? Have you told the whole story? And then we went on and really kind of drilled down into each so that we could fill in, the enormous amount that isn't there. And what I was really looking to do was get at the blind spots that a lot of us bring to this kind of reporting, try to figure out ways to correct for them in advance, so that we don't make a lot of the mistakes that you see over and over again in the media, which are unfortunate in that often, they're mistakes, things are wrong, but also because they have real world fallout, as Rhitu said. I mean, if you mess it up, you may be leading to a spate of suicides. You also may be leading in sort of the children's mental health world that I mostly have been writing about, to kids not getting treatment because their parents don't want to fall into whatever aspect of the, medico-industrial complex that's been laid out for them. So it's really important. So can we go to the next slide? So drilling down into, getting your facts straight, talked a lot about some basics, basic terminology, because that's really important. I mean, even things like, when do you say mental illness, mental health condition, things like that. And it matters a lot for clarity, but it also matters because there's often a lot of slippage in stories where, you have very vague language, or language that changes in the course of the reporting, or even sometimes in studies that are cited, you have that kind of slippage. And it's problematic. I mean, it's kind of clear sometimes, like with trend stories, if the language has to change along the way in order to keep the trend going, then there's a problem with it. We talked a lot about statistics. I mean, I'm not a math person. I was just literature all the way, which is maybe why I've worked so hard on, getting a good understanding of statistics. And, data is the currency of truth now. If the data says something, then we all have to, follow along and say that it's true. And it's very easy, I think, as a journalist, to be intimidated by the data, because you're, looking at work from academics most of the time, or maybe it's just sort of not your area. So that if someone is generating numbers, you're going to assume that they know more than you do. And undoubtedly they do, but you have to do your due diligence to know enough about statistics to be able to read them critically. Because what's ended up happening a lot is that the statistics that then take off and become storylines that are repeated over and over again, very often are those that sort of reinforce what people already think. It doesn't necessarily mean that they're true. They can sound very true, especially because they reinforce what we think. But you can have whole trends reported over and over again that are denied by other experts in the field. I mean, you can have pretty much a ubiquitous sense that something is wrong, and yet it becomes, cultural truth. So it's really, I think, the most important thing is to have your own kind of stable of experts who you go to when you've got a story that's sort of data heavy, or you're looking into something that's very reliant on data, because they'll be familiar with the statistics overall and have been following them for a long time and be able to contextualize them. So we do have a lot on that. Related to the getting it right piece, I just wanted to say, this is me talking, this is not in the guide. I think there's a tendency often in a lot of journalism to do something I think of as like playing God. You see this kind of gesture midway through, often in commentary especially, but also in news pieces, when there is very frequently a desire to kind of take on a seeming epidemic of something and say it's not real, or these disorders are not real, there's too much of this, people are, and then it goes into something about how people are really, take your pick, lazy, or looking to work the system or whatever else. And journalists always at a certain point start to decide what are real disorders and what aren't. And a lot of what makes that possible, because of course it's a ridiculous thing to do. I mean, look, as you read forward, look at stories and you'll see it, is that kind of mushiness around language and terminology. So once again, in terms of getting the facts straight, I mean, it's really right down to the basics of the words. Okay, let's go on to the next slide. So, this is moving on to the question of, do you have high quality sources? And we wanted to say flat out that if your sourcing isn't inclusive, then it's not high quality, period. Because if you're drawing always from a very small pool of people, and if that pool of people is very homogenous, then you're not getting the best people. You're not getting the full range of knowledge. You're not getting, by and large, very often, you're not getting kind of the younger generation of researchers who are often doing really, really interesting work. The usual suspects tend to get cited over and over again because they're the known names. But that's partly how you have these cultural narratives that become so strong and last so long, because you are quoting the same people over and over again. And I think there's been a lot of improvement with this. But given how homogenous the mental health fields are, especially in older generations, you have to make the effort, basically. And I think that, at least in my experience, editors haven't necessarily always gotten behind that or seen it as a necessity. I think that probably is changing a lot. As I say, I think a lot is changing generationally, but it's something that I still feel like has to be said, because it isn't necessarily taken for granted. One point that we wanted to get in also about sources was being sure to speak with people with mental illness rather than just talking about them and defining their disorders for them, which is something that I think Stephanie was getting at in terms of having these definitions and judgments essentially put onto you rather than being able to articulate it yourself and also speak to the fullness of the experience. So go to the next slide, please. This is just in talking about the importance of inclusion and sourcing, and also being very careful not to tell a single story about a narrow population and overgeneralize it to everyone. We included this is just a slide that's from the guide on cultural humility, which is a concept that is really from academia and is generally used to talk about how therapists should approach working with people of different backgrounds from their own. But I think it applies perfectly to reporting too. Just not making assumptions that you know more than you know, being aware of the limitations of your knowledge, and not overreaching, having the humility to be able to just ask questions is enormously important. Again, I think that in recent years, we've really come a long way with all of these kinds of things in coverage, but for a very, very, very long time, we were just generalizing from very, very small populations. I also, we have the caveat in place too. I think sometimes white journalists have a tendency to only go and quote specialists of color when they're writing a story about a community of color, to not do that as well, to normalize the experience of reaching out to an inclusive group of experts for everything. Okay, next slide, please. So telling the whole story here, we're talking about laying out the wider context that gets back to some of what Rhitu was saying about suicide, for example, not just focusing on the act in a very narrow way, not attributing mental illness, or suicide to a singular cause. And it's tricky because people often tell their own stories that way, actually, and their family members very often tell the stories that way. So it kind of means getting creative in the reporting. I don't mean to be invalidating what people are saying or the way they tell their own stories, but asking a lot of open-ended questions so that you end up with knowledge about a person and the context of their lives that goes beyond just, again, the narrowest focus on their mental illness. And considering solutions, talking about solutions often gets into what I think a lot of people consider the boring part of things. I have found over time that it's difficult to get space for it because editors often kind of don't want it and they cut it out. But when you think about it, we're talking about, at base, most of the time, structural problems. The story that you told was a structural failure. So many of the stories we tell are really about structural failures. Everything with mental health in our country is a massive structural failure. One thing that drives me crazy is, especially you heard this during the pandemic, all the calls for more mental health care. It's meaningless. It's absolutely meaningless in the system as we have it now. So we have to steer people to structural solutions. I can talk about this more after I've probably gone over, and I don't want to go too far over. The next slide, I'm not even going to pause on because this is what Rhitu was talking about, but we do have a section of trying to give the tips about the best practices around suicide for the reasons that she talked about. And then this, again, is another pet peeve of mine: provide help that's actually helpful. One thing that I find incredibly frustrating, both even in books, but in articles sometimes too, when there is a list of resources for getting help, and often it'll be like, the website of a government agency or the website of, a huge nonprofit. And if you're somebody who is actually looking for help for yourself or for your family member, it just compounds whatever whatever anxiety or sense of desperation that you're already feeling. So if it's possible and there is space for it, I think it's worth trying to go the extra distance to give people help that's actually helpful. So I'm going to stop there.
Thank you all so much. Does anyone have questions for any of our three? Yes.
The importance of checking the stats and making sure we understand them. I personally agree. I'm not a math person either, and I on a regular basis have to read a lot of academic studies. So what have you found to be most helpful methods for learning how to accurately interpret the statistical language we see, things like rate ratios or standard deviation? Because you're right, if we incorrectly do them, that can be a recurring theme, I guess.
Fortunately, you can look up the terms you don't understand. As sort of the basics. I was mostly a psych major and then switched to a million other things, but did have to take statistics, do have a basic background, so it isn't all a foreign language, but there's tons I don't remember, and I'm glad to be able to actually look up. But that's, sort of a Band-Aid in the short term while reading. I do have, a certain number of people who I'll go to say, like, does this actually hold up? It doesn't feel right to me. I think a lot of it comes to, as you said, you're reading tons of studies in the course of doing your research. After a while, you do become familiar with the pitfalls, because it'll come up, let's say, in literature reviews where they'll talk about the limitations of studies. Getting a basic, even if it means, doing some basic reading on statistics and getting a sense of what to look for, it's worth it, because it's a lot less complicated in a lot of ways than it seems, to be able to look for, basic problems like, and I come across them all the time. I'm constantly learning new ones. One that when I was working on the Carter Center Guide jumped out at me. There was so much reporting on the children's mental health crisis, and that was very much statistics driven between, let's say, 2020 and 2022. The government statistics, the main body of statistics, the best and largest, actually has a caveat. The version that came out in 2023 had a caveat saying that you couldn't compare 2020, 2021 to other years because the methods of data collection had changed. So, I mean, all of those stories, I'm not denying that there was a children's mental health crisis, but when people are just basing everything on statistics and running with it, and then it turns out that the statistics actually, like, oops, we shouldn't be comparing to 2019. It's a real problem. So reading the fine print, I didn't have to do any kind of specialized anything to just read the fine print and see that. There are all sorts of other pitfalls that I just keep learning about, frankly, in my reporting, because I now ask a lot of questions having to do with statistics, like the studies from the CDC that consistently show girls doing so much worse than boys. They likely are, but they're inflated because of the way that the surveys are written, pick up more mental health problems around that are in girls than boys. They're sort of skewed for internalizing disorders. So maybe I'm getting much nerdier than you need, but the more I look at it, the more skeptical I become about statistics. And also from working at a think tank in DC, which I did for about 10 years, and seeing how the sausage is made, I really see now that consciously or not, people derive statistics to back up the argument that they want to make. And that's not meant to happen in academia as opposed to, in partisan think tanks, but it still does. And someone pointed out to me the other day that Jonathan Haidt, who are the anxious generation, he has the whole statistics-driven argument about social media causing the children's mental health crisis. His early work was actually specifically on that, about how people form their conclusions and then backfill the data to back it up. So I think you just have to always approach it with skepticism and ask somebody else in the field who wasn't involved in the research what their take is, and also maybe more than one person, since everyone has these very strong positions. I'm sorry, that's such a long answer.
Can I just add to that last bit that you mentioned, especially? So I started as a science reporter, and like in my second internship at Science Magazine, I would do these, we all did these like quick hit 400 word pieces online based on one study. And they were pretty formulaic, but really good training ground. Like if you're covering one study, and you call the author first, and they're like, ask them, who are the other people in the field who weren't involved in the study that are really at the forefront of this field? And sometimes you get them referring their pals, but oftentimes when you ask the question often enough, you'll get a pool of people in the field. And normally the good thing about science is that people will, there's like disagreements are part of it's like a self-correcting process over time, right? And so having that, like if you're looking at one study, sending it to at least 2 other experts in the field, and over time you'll find a pool that's not just in the field, but also good at explaining it to a journalist for a lay audience. And so then you hold on to them. And that's sort of that's like a simple, concise way that you can start. Like if you're looking at one study, send it to a couple experts not involved in the study, in the field, knowledgeable, to break it down for you. And push them, as Judith was saying, push them to say, like, does this really hold up? And what are the caveats here? Like, give me some of the things that don't hold up. And that over time will, you'll get more comfortable doing that.
Lena.
Thank you. I have just like two questions. One, is there anyone you think is writing right now, or broadcasting or radio, that's particularly good in covering mental health that we could take a look at?
William Wan at the Post, I think, is really good. The Washington Post. He does, he's fortunate to do a lot of features. Only he's in the features section. He also, again, like, does these very personal stories, but also getting at the systemic structural issues. Aneri Patani, I saw that you had
Yes.
her. She's pretty good. She's at Kaiser Health News, does a lot of radio for us as well.
She's also an NPR fellow.
Oh, great.
Aneri Patani.
I think there are a lot of really good people now.
Yeah.
I think there used to be a lot of a lot of really bad people who were covering it, and I think that that's changed. I really recommend, if maybe you're already familiar with it and you get it, but Mindsight News, they generate their own coverage, and they also are great, like, consolidator in a daily newsletter of good, interesting mental health stories that that often are not necessarily what you're reading everywhere else.
Another name I'll throw out who's excellent at this and has been doing it for NPR out of the San Francisco Bureau for a lot longer than I have, April Dombosky. Is also very good.
And then I just, right before this, and I'm sure you both saw this, right before coming down here for this, I saw in the Times, I was talking too much about mental health. And I thought, and it's a study that the Times covered, a reporter, or
Ellen Barry.
About just, it seems to sometimes, I guess, cause more problems talking about mental health with students, children, than sometimes they seem to be worse off. I just was wondering, we had someone, two things. We had someone in here who was sort of complaining about headlines and how often people don't read past the headlines, which obviously we all know that's not something we can control usually. But also just in that story in particular, what pitfalls, I don't know, I read it, I can't say, but it seemed to have a lot of pitfalls of falling into what you people discussed.
That was from about a week ago, right?
Something like that.
I mean, that's the kind of thing that just drives me nuts, because you read through the story, you have one study suggesting that, you then have a whole slew of people who say it's much better to be talking about it than not talking about it. The problem is a lack of care. The story contradicts itself midway through and then consistently contradicts itself. And I do think that there is, and this happens over and over and over again, there's a slapdown when it comes to giving voice to people who are struggling with mental health conditions. There's a kind of shut up, you don't have the right to this story. Now that's really focused on young people, because it is another way of getting at young people, because it is younger people who talk about it more, kind of, oh, they're whiners, they're self-indulgent, they're, and I think it happens so much, and it just takes on different forms. And it's very convenient, in a society where you have no mental health system and where most people can't access decent mental health care. It's really convenient to say, like, oh, we're talking about it too much.
Well, just to follow up on that, let's say I don't do that, I don't do daily reporting, but you're given this study as a reporter, and your editor says, cover it. Do you, look at it, do all the things you suggested, but you're right, it comes and then it says, well, obviously there's a lot of pushback to this idea, but I don't know if you can say, but how do you cover a study like that that's not doing what you just said? But,
Well, the problem is that you don't write your own headlines. The story itself was okay. If you read all the way through to the end.
Right, but would you bring it up to the top more, or how do you do that?
But you don't know what your editors, that's the thing. I don't know. Also, it wouldn't become a story if there wasn't that.
Here's a response to a study, I'm not telling you that to the bottom.
it wouldn't be a story then. So I think the issue is, I suppose, do you cover it, and then can you advocate for yourself strongly enough to get the points that you want made that you believe are true, and that are really reflect reality made. And I think that's often easier said than done.
And I just say the Times has like a learning part where they reach out to middle school kids, and they did reach out on the story and say, what do you think, to 13 and 14-year-olds? So be interesting to see the response.
Yeah.
Any other questions?
Just want to follow up on your last point of your original talk. For resources that are, I've definitely been guilty of just like throwing on the resources at the bottom of like, the government organizations, or like call the suicide hotline number. Do you have specific recommendations for actually good resources?
There was one story I did where I felt good about it, and I got them by, it was a story on the children's mental health crisis that was in the Washington Post magazine when it was still a standalone magazine. But I basically asked people I was interviewing, or it would come up because I was interested in solutions. Various resources would come up as parts of solutions, and then I went sort of I followed up on various, leads that came up in different interviews to see what was out there and what was good, and then check that it was good.
Can I add to that? So the other thing I would say is, going back to your point about the importance of solution stories, and I'm fortunate that NPR really does a lot of these. We have a whole podcast called Life Kit, and I've done several episodes for them. There's also plenty of room for sort of, if you're writing about a topic, say I've done a couple pieces now on suicide prevention, because once I started reporting on suicide, it became clear, like I was hearing a lot from people with lived experience of suicide attempts, and people just like mental health care providers working with suicide, that there weren't enough prevention stories. And I was also hearing that families are often like, don't even know what to do. I was hearing like, oh, suicide prevention, but how do you prevent, and how do so there are stories to be done, like what are just informing people about symptoms to look for. And in terms of where to go for help, luckily, you can call organizations like NAMI and find much more specific resources, like find your local, NAMI chapter, or are there parents group, like things that are very specific that would likely to get them a quicker response, support groups, and things like that really resonate with people. So like the stories I've done I did 2 just in general on how do you even tell when a loved one may be struggling with suicide, and how do you best support them. And that I did a similar one for kids. My colleagues over at Life could tell me, like, not only have they been like downloaded a lot, but like the staff members have had people to send them to, because they've had people they know who are struggling with this. They just don't know where to go and are already too overwhelmed. So just very specific sort of tips on for families dealing with specific mental illnesses, mental health issues are incredibly, like, there's not enough of them out there.
Stephanie, I know that you are often include solutions in your work. Do you have anything you want to add?
Yeah, I was going to say that, in my book, I tried to lay out like a personally trusted, tried and true roadmap for healing, just trying everything under the sun, and laying out what worked for me and what didn't. I think that trying to be really vulnerable and honest about all of that has been really helpful for people. I do have a list of resources as well in the back of the book. I think that I've sort of just accumulated them over time, like as I come across these resources just in my reporting, in life, in scrolling through Instagram, everything from Instagram accounts to organizations that provide free or discounted therapy to minoritized communities or activists or journalists. I try to accrue all of those and share them because, yeah, I mean, I think trying to provide resources for finding affordable healthcare is pretty much the primary thing that I often want to focus on when I'm creating these lists. I also give a lot of books, articles, that kind of thing that have been really helpful to me for people who can't afford any form of therapy and sort of need something to read to hold them over.
Thank you. We have time for one or two more questions. Yes.
Can you talk about, so how do you decide what stories to pursue? And also, we've been hearing a lot about how, and even in my own reporting, I've seen like access to mental health care is a huge problem, like the insurance payment issue is a huge problem. So it's like, those are kind of always the explanations as to why people aren't getting care. So I guess like, how do you kind of deal with sort of like, in a way that's the narratives are kind of, or the explanation is repetitive, I guess. And then how do you find like your real people? Is it someone comes to you and says, I have, you know, this happened to me or whatever? Or how are you finding your real life examples?
So I'll start with the second question first. The real life examples, oftentimes support groups, you know, providers will sometimes connect me to people. You talked about insurance, like one story I did about a highly suicidal teenager not being able to access care, then finding the right care, and then her insurance bumping her off, came to me through a lawyer who advocates for parity. So like there's different, and again, like the story I mentioned of the nurse who died came from a psychiatrist. So a lot of sources, I mean, what I have found is once I started doing this for a little bit and people trusted me for responsible, nuanced reporting, even healthcare providers were very, very hesitant to connect them to their patients, would often reach out and connect me to people. Yeah, I don't know if Stephanie and Judith have other ideas.
Yeah. Oh, sorry, go ahead. I really tried to find success stories. And so I think I ask around a lot in terms of who's doing this well, who are the people who are healing, how do we heal from this? Because I think that it's very easy to find the bleakest stories often, and it's much more difficult to find the stories that are actually working. And so when the way that I found my therapy Ghostbuster story is I just literally called all the Asian therapists I possibly could in San Jose, because I was trying to look into the question of how do we heal intergenerational trauma in majority immigrant communities. And so I just called every Asian therapist I could, and I was like, who is doing this right? How do I posed this question? And then often I also send good story guidelines to people like my sources, to therapists, pretty much laying out for them what a good story is. Like, I would love a great character who has, you know, overcome something, has changed, has a great beginning, middle, end, has you know, overcome this conflict, whatever. And I'm just like, can you help me find these characters? I've reached out to when I had to find a great intersex character, I reached out to a bunch of intersex organizations, and I was like, I'm just looking for this character specifically. Same for veterans organizations, and I've let them find people for me, basically, and I've had a lot of success with that.
All right. Well, thank you all very much for sharing your expertise with us.
Thank you for having us.